These are my children, right after I've asked them for the third time to go and brush their teeth and go to bed. And for some reason or another, they sometimes seize one of the infinite means of power, blocking their ears. Obviously, children are good at non-listening. I doubt there's anyone here who hasn't been to a doctor in recent years and experienced some degree of not being listened to. A recent survey among almost 5,000 patients revealed that 40% did not have the feeling that their doctor was listening to them very well. I frequently hear it and see all kinds of complaints online on rating sites about non-listening doctors. Is this an epidemic of non-listening in healthcare? I think so. Estimations are that up to 60% of second opinions are due to patients having the feeling that their doctor wouldn't listen to their story, or more specifically, their whole story. So, with this in mind, I did some field research that I would like to share with you. I thought it would be interesting to be a fly on the wall, so I installed a hidden camera in the consulting room and looked what happened. After thorough analysis of the footage, I've come to what I call the 4 stages of non-listening disorder. Let's have a look at some of the images. Here you see a typical doctor on an ordinary day in the consulting room. It seems like he's listening to his patient in a rather intense and relaxed way, but look at his hands. They reveal what's really going on in his mind. He eagerly awaits the chance to put the data in the medical file. I call this stage 1. Here you see the doctor at stage 2, still more or less listening, but simultaneously typing the data into the computer. Stage 3 is characterized by a different body posture of the doctor, which obviously isn't going to benefit his lower back and forehead wrinkles. A typical example of stage 4 is shown here. The doctor is completely preoccupied with all of his obligations, and the patient seems to be a bystander who's not being seen. Now, if we look at the causes of this non-listening disorder, what could these possibly be? Don't most young people enter med school do so because they want to help people? Don't junior doctors have all these communication training during their education? That's all true, but I think one of the main reasons for doctors to lose their skills of good listening is the fact that today, healthcare isn't merely about patients anymore. It's all about the electronic medical file, administration, research output, struggles with healthcare insurances, legal issues, training, supervision, keeping up with the abundance of literature, and so on and so on. With all the obligations doctors currently face, patients are just one of them. Consequently, one of the biggest concerns among medical personnel today is the rising amount of physician burnout. You may have seen this iconic photo of an ER doctor after he had just lost a patient. It went viral. Books on physician burnout and even physician suicide have become international bestsellers. Studies show that, on average, 45% of doctors meet criteria for burnout, with specialties like critical care medicine reporting rates up to 60%. These are, of course, alarmingly high percentages and do not only affect doctors' personal lives, but also the quality of care. Now, from my own experience as a medical doctor in obstetrics and gynecology, I know the effect of being overstretched or burnt out. I've seen what it does on patient care and realized what dies first in the front line of communication, which is the ability to listen thoroughly to patients. How can you possibly hear what somebody else is saying with all this interference in your head? I know from at least one patient that had to physically bear the consequences of my non-listening. Because I didn't hear what she was actually telling me, the right diagnosis was made with delay. And as a result, She had to wear a urinary catheter for 2 months. Now that was a major turning point for me. Considering the current healthcare system, how could there possibly be a solution for all of this? The administrative burden will not likely decrease in the next few years, nor will there be less struggles with healthcare insurances or legal issues. Well, ideally, from the doctor's perspective, more focus on peer support and self-management should be realized. When I told some of my colleagues about the level of pressure and stress I was experiencing, their reactions were, you just need a holiday, and yeah, we're all very busy, that's life. However, there is a general saying that states, happy doctors, happy patients. And I really believe this to be true. And from the patient's perspective, when any one of you comes across a doctor in a consulting room who is behaving like stage 2 or more, please speak up and say something like, "Doctor, I've got the feeling you're not actually listening to what I'm saying. Is there anything I can do to explain myself better? Or could you just give me 2 uninterrupted minutes of your time to complete my story?" In this way, we'll see more of these ideal images, and both patients and doctors can put an end to this epidemic of the non-listening disorder. And my kids, well, it seems they've got some basic listening skills after all. Thank you.